Let's talk foam rolling and why this little tool is part of the pain-free pregnancy and postnatal toolkit I encourage every woman I work with to use. So if you want to stay as mobile and pain-free as possible throughout your entire pregnancy and postnatal journey, then this video is absolutely for you. Now, of course, if you follow me, you'll already know I talk a lot and in great detail about things to modify or avoid during pregnancy. But I think it's just as important to go into detail about things that are really important to include during this time. And in my eyes, during your pregnancy and postnatal journey, the foam roller and trigger point ball should literally be your best friend for many reasons, but including things like managing aches and pains and postural changes, fluid retention and blood flow. For those of you who don't know, foam rolling is a form of self-myofascial release or soft tissue work. So it's kind of like going for a massage, but that you do yourself, right? And using a foam roller actually enables you to help self-manage your aches and pains as much as possible during pregnancy. And the underlying mechanism of why foam rolling works is still being researched and debated, but the benefits around improved joint range of motion, improved recovery, and decreased muscle soreness along with reduced perceived pain are really clear. And the current belief is that localized tightness causes restrictions in joint range of motion and local blood flow, and that manual manipulation of this tension will enable the tissue to become softer and more pliable. Now, another belief is that the improved recovery, decreased muscle soreness and reduced perceived pain are due to increased blood flow, which enhances the removal of blood lactate, decreases fluid retention and helps deliver oxygen to the muscles. And if you ask me, these are all huge green ticks. Now, when it comes to your pregnancy and postnatal journey and why foam rolling is so important, you just need to think about the vast, and I'm talking about the many changes that your body is going through right now and the effects that this has on your musculoskeletal and circulatory system. So just from a musculoskeletal perspective, you have a really long list, and we'll go through these now, just to name a few, of course. So you've got your anterior pelvic tilt that happens due to the change in center of gravity, and the effects of this are felt up and down your body. You have the increased weight of your breasts and of course your growing baby, placing pressure on your upper body. And when it comes to your upper body, you also have the thoracic and cervical spine compensating or counterbalancing the anterior pelvic tilt by curving forwards. You have the joint laxity in your lumbar spine due to hormones and the changes to your abdominals. You have the widening and increased mobility of your pelvis that allows you to birth your baby, along with the weight of your baby adding extra pressure to your lumbopelvic region. It's a lot, right? Now, in an oversimplified explanation, all of these things have corresponding effects to your muscles throughout your whole body, from tightness in your neck, upper traps, teres minor and chest, lower back, hip flexors, quads, calves, and many of the stabilizing muscles of your pelvis. Again, it's a lot, right? But the foam roller can help you manage some of this tightness and decrease any of the aches and pains that you're feeling due to these changes and tightness. And the mobilization, combined with strength training, following a correct program of course, can actually help minimize the overall effects of pregnancy on your musculoskeletal system as a whole. Again, loads of green ticks there. But you also have massive changes in your circulatory system during pregnancy as well. And the two main ones in relation to foam rolling are increased blood flow and reduced fluid retention. So remembering during pregnancy, your blood volume increases up to 40 to 50%, causing your heart to work harder to pump all that extra blood around your body. And when you're into your later stages of pregnancy, or if you've been standing up or sitting down for long periods of time during the day, this can make it all that much harder for your heart to pump that deoxygenated blood back up from your lower limbs to your heart, right? And this leads to something called venous insufficiency, which can cause things like swollen legs, pain, night cramps, numbness, and itching. And the statistics show up to 80% of pregnant women get some kind of venous insufficiency during their pregnancy. When it comes to how foam rolling can help with this, one study on foam rolling and blood flow actually showed that blood flow improvements directly after foam rolling increased by almost 74%, and after 30 minutes showed a significant increase in tissue circulation, with blood flow increased by 53%. So you can imagine the improvement this would have to symptoms like night cramps if you had, say, a warm shower, foam rolled, and used topical magnesium before you went to bed, which is a great tip right there, by the way. And when it comes to the decrease in fluid retention, this will mainly be caused by the increased blood flow, decreasing inflammation, and increasing oxygen delivery to your muscles. Now, of course, the women that I work with have very specific foam rolling and SMR release work that they do. But if you were going to force me to choose 3 big bang for your buck foam rolling exercises to help with all of the above, it would be the following. Calf or foam rolling your calf, which is going to help bring deoxygenated blood back up to the heart, decreasing any fluid retention around your lower legs, help with any tightness in your calves, which also has a flow-on effect to joint mobility in training, as your ankle mobility is hugely important to any lower body exercises that you do, because if it doesn't have good mobility, the joints above it, i.e. your knee and hips, will have to take on more of the load. An important thing that you want to think about when foam rolling your calves is to make sure that you're always going upwards, not rolling up and down, because remember, this has to do with blood flow. Then of course you want to foam roll your glutes, or more specifically the stabilizing muscles of your hip complex during pregnancy, because they can typically get tight because they're being recruited to help stabilize your pelvis. Now this can lead to or contribute to lower back pain. Then you have thoracic mobility, or foam rolling your thoracic spine, which is responsible for rotation. And this has a lot to do with your posture as well. So when it's curved, it limits your range of motion. And in terms of muscles that are more affected through that curved spine, you tend to have weaker mid-backs, which can lead to upper back and neck pain, along with shoulder issues, just to name a few. And foam rolling your thoracic or coming into extension through these joints helps bring it back to a more neutral position. And this is especially good for the entire pregnancy and breastfeeding journey. Now, I think that's it from me today. I really hope this video helps. And of course, if you want more pregnancy-specific content, feel free to apply to my complimentary but private community, the Preggy Training Crew. The link is in my bio.